Now, next one is what do you mean ciliary ganglia? What is the preganglionic parasympathetic outflow from the edingerosval nucleus? Now, see, from the edingerosval nucleus, same way, I'll give repeat very again. From the edingerosval nucleus, the preganglionic parasympathetic outflow will come. It will follow the course of oculomotor nerve. That means it will pass through the oculomotor nerve, through the inferior ramus of the oculomotor nerve. It will enter into the ciliary ganglia. It will interrupt at that level. Now, from there, the postganglionic fiber will travel through the short ciliary nerve and finally supply the ciliary muscle and sphincter pupillae. So this is the overall course of preganglionic parasympathetic outflow of oculomotor nerve. Now, so this is a summary for you. The oculomotor nerve. What is the function? What are the functional components? One is the somatic event. Next one is general visceral event. Location midbrain, motor nucleus, edingerosval nucleus. How it come out from the cranium or the skull? From the supraorbital fissure, it is going to supply the extraocular muscle except SO and LRs or supraoblique and lateral rectus. Movement of eyeball is the main axon. Sphincter pupillae, ciliary, pupil constriction, accommodation. So this is the overall summary of oculomotor nerve. Now, is it clear? Oculomotor nerve. The next one is what do you mean by the oculomotor nerve palsy? That means this oculomotor nerve, motor nucleus of the oculomotor nerve is supplying the extraocular muscle. So there may be a ptosis. Ptosis means drooping of upper eyelid. Now, can you see the drooping of upper eyelid over here? This one, and over here also you can see the drooping of upper eyelid. Drooping of upper eyelid. Now, why there is a drooping of upper eyelid? Because levator palpebral superior, which is responsible for elevating upper eyelid, is not working. It is paralyzed. So we have the drooping of upper eyelid. Now, next one is external external squint. So external squint bane ko the eye will look laterally and downward. Now, can you see? That is squint bane. That has a name, no? Lateral and downward. Now, why the eye or the pupil will move to the lateral side? Because the lateral rectus, not the lateral, because the medial rectus is paralyzed, and the medial rectus is supplied with oculomotor nerve. So the medial rectus will paralyze, and the lateral rectus, which is present on the lateral side, so that will pull the pupil laterally, or that will pull the eye laterally. So the eye will look lateral. Now, diplopia, dull vision, dilated and fixed pupil. You know why there is a dilatation? Because the sphincter pupillae or the constriction pupillae is paralyzed. Why there is a loss of accommodation? Because the muscle, extraocular muscle are paralyzed. And next one is sphincter pupillae, ciliary muscles are also paralyzed. Now, next one is proptosis, prominence of eyeball, because most of the muscles of the eye are paralyzed. That's why there is the relaxation. As a result, the eye will just come slightly anteriorly. That is known as the proptosis. So these are the applied aspect of the oculomotor nerve. Now, if you have any confusion related to the oculomotor nerve, then you can ask me. Otherwise, I'll move to other cranial nerve. Hello? This is oculomotor nerve. Okay. Now next, which one is the fourth cranial nerve? Fourth cranial nerve is the trochlear. Trochlear nerve is the fourth cranial nerve. Now, what type of nerve is this? Motor. Motor. Now, what is the functional component of the trochlear nerve? Somatic efferent. Same. Somatic efferent. And does this have the preganglionic parasympathetic outflow? No. No. That means oculomotor nerve, trochlear nerve, and next one is the abrasive nerve, because this is the trochlear nerve, which is the fourth one. When mnemonic Q2 SO4 and LR is 6, lateral rectus by 6. So fourth cranial nerve, fourth cranial nerve, sixth cranial nerve, and the third cranial nerve will have the same functional component, that is the somatic efferent. Is it clear this one? Now next one is This is the only cranial nerve that will come out from the posterior surface of the brainstem. Now, when you see the ventral surface of the brainstem, most of the cranial nerve are emerging out from the ventral surface. But the trochlear nerve is coming out from the dorsal side of the brainstem, and it might come in your MCQ. Which of the following cranial nerve will arise from the dorsal aspect of the brainstem? And this is decussating with another cranial nerve, another trochlear nerve on the opposite side, and it is coming anteriorly. Now this is going to supply SO4, that means superior oblique muscle. Now the nuclear origin you can see over here, when you see the cross section at the level of the inferior colliculus, then at the anterior part of the brain matter, you will have the trochlear nuclei. So this is the trochlear nucleus. Now what is the course of the trochlear nerve? Immediately it will decussate with the opposite side when it come out from the posterior surface of the midbrain. Then next one, then it will emerge out. Can you see this part of the trochlear nerve? Now it is emerging out from this. So it will be emerging out from the posterior surface of the midbrain at level of the inferior colliculus and on each side of the frenulum villi. Then it will pass forward. So then it will pass laterally. Then it will pass posteriorly, anteriorly, or laterally, lateral to the cross cerebri. So by the side of the cross cerebri, on the lateral side of the cross cerebri, we can see the trochlear nerve. Now later on, this is also the another cranial nerve which will pass through the lateral wall of the cavernous sinus. So this is the trochlear nerve which will pass through the middle cranial fossa in the lateral wall of the cavernous sinus. Then it will exit through the cranium. So how it is going to exit through the cranium? Through the supraorbital fissure, same one. You can say this one is the supraorbital fissure. This one is the lateral part. This is the intermediate part, and this is the middle part. Now, can you see the trochlear nerve? So you can see. Okay. So this one. Can you see the trochlear nerve? So this is the trochlear nerve which will pass through the lateral part of supraorbital fissure, and this will enter into the orbit and finally supply the superior oblique muscle. Can you see? Can you see? Can you see this muscle which is winding? This one is the superior oblique, and this is the trochlear nerve. This is supplying the superior oblique muscle. So this is the overall course of the trochlear nerve. Now the trochlear nerve is supplying the superior oblique muscle. Now see this diagram. Your diagram is right. So this is the medial side. This is the lateral side. We have the medial rectus over here. We have the lateral rectus. And over here we have the right superior oblique. You class very orbit eyeball mounts, right? So function or action of all those extraocular muscles. Now just see over here. Now just see the superior oblique. What will be the action of the superior oblique? The superior oblique muscle is causing the depression of the eyeball and abduction of the eyeball. So abduction and the depression will be caused by the superior oblique. That is the action of the superior oblique. Now, just imagine if the trochlear nerve is damaged, then superior oblique muscle is paralyzed. Now, what will happen? The eye you'll not be able to turn eye downward and laterally. So you'll have difficulty in turning the eye downward and laterally. So this is the applied aspect of the trochlear nerve. Then you will have the double vision when you are looking lateral and downward. And you can see over here the eye is the eyeball of the pupil. So over here, this is just present above the horizontal line. So this is the applied aspect of the trochlear nerve. Is it clear the trochlear nerve? Yes, ma'am. Now I'll move to another one that is known as the abrasion. I'll be using the fifth cranial nerve later on because this is the abrasion nerve. This is also supplying the extraocular muscle. So together with other cranial nerve, trochlear and the oculomotor nerve, I'll be using the abrasion nerve as well. So the abrasion nerve is also a motor nerve. The functional component is same, that is the somatic brain. Now the nuclear origin. For the nuclear origin, you have to see the floor of the fourth ventricle. Minus the practical floor of the fourth ventricle. You can see the abrascent nerve. This is the abrascent nerve, which is winding by the facial nerve. This is the abrascent nuclei, which is winding by the facial nerve, and this is producing some elevation that is known as the facial colliculus. So, what will be the nuclear origin of the abrascent nuclei? It is present in the posterior surface of the bones, or in the floor of the fourth ventricle in the facial colliculus, just beneath the facial colliculus. That is the location of abrascent nucleus. Now next one is superficial origin. Now this one is the superficial origin. Now the superficial origin is, it is on the motomedullary junction above the pyramid. So this is the abrascent nerve. Now the course, it will also pass through the lateral wall of the cavernous sinus. You can see this is the okay. So this one is the abrascent nerve. So it will not pass to the lateral wall. Sorry. So it will not pass to the lateral wall. It will be the content of cavernous sinus along with the internal carotid artery. So it will present lateral to the internal carotid artery. It will pass through the cavernous sinus, and it will enter into the orbit through the supraorbital fissure. Can you see the supraorbital fissure over here? And can you see the abrascent nerve? So it will pass through the intermediate area of the supraorbital fissure and enter into the orbit and supply the lateral rectus muscle. So this one is the lateral rectus. Now you can see this is the lateral rectus and this is the abrascent nerve. Now what is the action of the abrascent nerve? The lateral rectus means the lateral rectus. What will be the action of the lateral rectus? The lateral rectus will pull the eyeball laterally. But whenever you have the lesion in the abrascent nerve, the lateral rectus muscle will paralyze. As a result, the person will be unable to turn eye laterally, and you will have the internal squint due to the unopposed action of the medial rectus. Is it clear, this one? Please so on the body. Hello? China man. The next one is the trigeminal nerve. The fifth cranial nerve is the trigeminal nerve, and this one is the largest cranial nerve. And the nuclei of the trigeminal nerve will extend throughout the brainstem. Now, can you name what type of nerve is the trigeminal nerve? Mixed. It is the mixed one. It consists of both motor, it consists of both sensory. That means what will be the functional component? Which one's a functional component? Special visceral efferent. Special visceral efferent. Okay, good. Then general somatic efferent. General somatic efferent. Afferent. Afferent. General somatic efferent भयो भने त्यसले प्रिग्याङ्ग्लियनिक आउटफ्लो लिन्छ र दिँदैन है GSA है now see what you have to do is a functional component याद गर्न गाह्रो छ हो तपाईहरुलाई I'm asking you, is it difficult to memorize the functional component? हेलो खै त कसैले रेस्पोन्सै गर्नु न त बुझेपछि इजी नै छ म अरूहरूलाई भन्छु ल तिमीलाई त इजी छ म अरूलाई now just see first what you have to do is the trigeminal nerve. Suppose let us take an example of the trigeminal nerve. The trigeminal nerve is the mixed one. Everyone, most of you know this one. Eh? It is consists of the sensory part, it consists of the motor part. That means you will have the functional component as E and A. This is the afferent, this is the efferent. Because it's mixed one only with the efferent पनि हुनु पर्यो, afferent पनि हुनु पर्यो. Now what you have to do is you have to find out the function of the trigeminal nerve. Trigeminal nerve ले के गर्छ? The trigeminal nerve is supplying the muscle of mastication. Most of you know. You know, most of you know the muscle of mastication is supplied by the trigeminal nerve. Now, a muscle of mastication, the muscle of mastication will arise from the pharyngeal arches, the first pharyngeal arches. Now just recall our first class. The muscle, if anything will innervate the muscle derived from the first pharyngeal arch, then that is the special visceral efferent. अब special visceral efferent apart from trigeminal nerve, what are the other nerve that will have the same functional component? Trigeminal nerve like or nerve हो जसको special visceral efferent हुन्छ. Facial nerve because second pharyngeal arch, then glossopharyngeal nerve, that is the third pharyngeal arch, then we have the fourth and sixth, that is the vagus. Now those will be having the same functional component. Now next one is we have the this one is the sensory. The trigeminal nerve is also the sensory one. So we have the afferent also. Now the trigeminal nerve is sensory मा के गर्छ त कुन part हाम्रो body को कुन part बाट it will carry the sensation. It will carry the sensation from mainly from the breast area. Oh, that's why we keep this one as a general somatic afferent because it is carrying the general sensation, not the special one. अब special भएको भए के हुन्थ्यो visceral afferent हुन्थ्यो. But it is not carrying the special sensation. It is carrying the pain, toss, pressure, temperature, those general sensations. So we have the general somatic afferent. So it is carrying the exteroceptive and proprioceptive भनेको थाहा छ होला. Exteroceptive भनेको outside, it may be a toss, pressure, temperature, pain. Proprioceptive भनेको muscle and joint sensation. So from cornea, skin of face, scalp, eyelid, nose, paranasal sinus, nasal cavity, teeth of upper jaw. So from this area, it will carry the general sensation. And to carry the general sensation, our general sensation lead आयो, so we have the nucleus for that one, which will sense each different sensation. We have the principal, spinal, mesencephalic. These are the three different types of sensory nucleus of the trigeminal nerve. The next one is special visceral efferent. It will because it is supplying the muscle of direct from the first pharyngeal arch, that is the muscle of mastication, and those will be represented by motor nucleus. I'll show you the nucleus of the trigeminal nerve. So we have the motor nucleus. This is the motor one. We have the long sensory one. We have the mesencephalic, principal, and the spinal. Each for different functions. So the spinal will receive pain and temperature sensation. The principal will receive touch and pressure. Mesencephalic, this one will receive joint muscle and joint sensation. Now just first move to this sensory or the principal nucleus. So the principal nucleus of the trigeminal nerve is present within the bones. It will continue below with the spinal nucleus and above with the mesencephalic nucleus. Now the spine, this one is the principal. It will receive the fiber of the touch and pressure. Now next one is the spinal nucleus. The spinal nucleus will extend throughout the medulla oblongata up to C2. तपाईहरुले spinal cord को cross section हेर्नुभयो भने when you see object the cross section of the spinal cord and not the cross section भन्दा पनि when you see the nucleus of the spinal cord को nucleus हरु हेर्नुभयो भने over there you will come across the spinal nucleus of the trigeminal. त्यो पनि याद गर्नु है because C2 सँग extend हुन्छ. Now this spinal nucleus will receive the fiber of the pain and temperature. The next one is the mesencephalic nucleus. The mesencephalic nucleus is present within the brainstem or within the midbrain around the cerebral aqueduct. So you can see this one is the mesencephalic nucleus. It is present within the gray matter of the midbrain, around the cerebral aqueduct, and this is going to receive the proprioceptive sensation, muscle and joint sensation. It will receive the pain from the muscle of mastication, pain general sensation from the muscle of mastication, facial expression, TMJ, extraocular muscle. So all the muscle and joint sensation of those area will be received by mesencephalic nucleus of the trigeminal nerve. The next one is the motor nucleus. Now see, this one is the motor nucleus over here. Now the motor nucleus, The motor nucleus, take it also, the motor nucleus of the trigeminal nerve will supply the muscle of mastication, and it is having the functional component as special visceral efferent. Now, where is the motor nucleus? The motor nucleus is somewhere over here. Can you see? This is the motor, this one is the sensory. The bigger one is the sensory, the smaller one is the motor. It is situated within the bones, just medial to the principal nucleus of the trigeminal. It will supply the muscle of mastication, those muscle of mastication plus other muscles which are arised or which are derived from the first pharyngeal arches. The first pharyngeal arches are down in kikyo muscle. Next one is, what is the course of the trigeminal nerve? It will run forward. Now just see, when it come out from the ventral surface of the bones as a motor root and the sensory root, then it will run forward and it will rest on the upper surface of the apex of the part of the temporal bone. Now let's see, this is the interior of the cranium, your interior of the cranium move. This one, can you see the rock-like structure? This is known as the vitreous part of the temporal bone. Now can you see this part? This is the apex on the upper surface of the vitreous part of the temporal bone. This one, somewhere over here, we have the trigeminal ganglia. So this is the trigeminal ganglia which will be present in the impression that is present above the apex of the vitreous part of the temporal bone in a middle cranial fossa. Now you can see over here, this is the trigeminal ganglia. That means when it come out from the dorsal side, or sorry, when it come out from the ventral surface of the bones, then the sensory root will expand and it will form the trigeminal ganglia. Now, from the anterior border of the trigeminal ganglia, we have the V1, V2, V3 will arise. That is the ophthalmic, maxillary, and the mandibular nerve. Now, those will arise from the anterior border of those ganglia. Now, how it will enter? Now, how it will enter? It will enter into the. Okay. So, how it will come out from the cranium of the sedum? Just first, just see the ophthalmic. Ophthalmic is not going to Okay. Now, just see the ophthalmic nerve. Yes, what would you say? So, from the ventral side, so from the anterior part of the trigeminal ganglia, we have the V1, V2, and V3. Now, first to stress the V1. The V1 is the ophthalmic nerve. Oh, our ophthalmic nerve as a whole, because ophthalmic nerve has the further branches. We have the lacrimal, frontal, and nasociliary. That means ophthalmic nerve will be divided into three branches: lacrimal, frontal, and nasociliary. And those branches will come out from the supraorbital fissure and that will enter into the orbit. Orbit one, okay. सबै त orbit मा जाँदैन है. Okay. Okay, it will enter through the supraorbital fissure. It will pass through the supraorbital fissure and it will enter into the orbit. Orbit may overall contain Now, see the lacrimal. So this one is the lacrimal, this one is the frontal, which will pass through the lateral part of the supraorbital fissure. The next one, this is the nasociliary, which will pass through the intermediate part of the supraorbital fissure and finally enter into the orbit. अब orbit मा तपाईले theory class हुँदा practical class हुँदाखेरि you will see the lacrimal nerve, frontal nerve, and the nasociliary. यो सबै देखिन्छ त्यसमा. So all will enter into the orbit. यो बुझ्यो अब ophthalmic को? Now just see, I'll repeat once again. So this one is the trigeminal ganglia. This is the anterior border of the trigeminal ganglia from where we have the three divisions, V1, V2, V3. The V1 is the ophthalmic, which is pure sensory. It is pure sensory. So the V1 nerve, this is the ophthalmic nerve, which will pass through the lateral wall of the cavernous sinus. It will pass through the lateral wall of the cavernous sinus. Then it will enter into the orbit through the supraorbital fissure after dividing into the three branches. So lacrimal, you can see the lacrimal, you can see the frontal nerve, and you can see the nasociliary. Now, just trace the frontal nerve. When you trace the frontal nerve, it is further divided into supraorbital and supratrochlear. Those are the further branches of the frontal nerve. Supraorbital and supratrochlear. Now next, nasociliary with the further branches of the side, right? Okay, nasociliary with so this one is the nasociliary, which has got the branches like anterior and posterior ethmoidal, infratrochlear. Those are the branches. Can you see the infratrochlear nerve, anterior and the posterior ethmoidal nerve, and branch to the ciliary ganglia. Okay? So those are the branches of the nasociliary nerve. Now this one is a table for you, the ophthalmic nerve. What you have to know is ophthalmic nerve is V1. It is a pure sensory one. So sensory, we have the general somatic afferent because this ophthalmic nerve is carrying the sensation from the particular area of our face. Trigeminal ganglia, the branches exit out through the supraorbital fissure. We have the three branches, main, lacrimal, frontal, nasociliary. Supratrochlear, supraorbital are the two branches of the frontal nerve. Anterior, posterior, and infratrochlear are the three branches of the nasociliary nerve. Now, what is the V1? The V1, that means this will carry the sensation from the scalp, forehead, upper eyelid, nose, cornea, conjunctiva. So you can see over here, this one is the V1 area, the trigeminal VO area. Right? So from the scalp, from the forehead, from the upper eyelid, from the nose area. So this will carry the sensation from those areas, ophthalmic division of the trigeminal nerve. Is clear this one? Next, I'll move to the maxillary nerve. Now, from the anterior part of the trigeminal ganglia, the V2 arise, and this V2 is also the sensory one. Sensory, right? Sensory, it has the functional component as general somatic afferent. Now, it will also pass through the lateral wall of the cavernous sinus. Then, it will pass through the foramen rotundum. It will come out through the skull. Foramen rotundum, foramen ovale. What are the structures that will pass through the foramen rotundum and foramen ovale? I think you know this one. Now it will come out through the foramen rotundum. It will enter into the pterygopalatine fossa. I've already told you about the pterygopalatine fossa penthasa. It will enter into the pterygopalatine fossa. Then it will pass through the infraorbital fissure. Can you see the infraorbital fissure over here? And finally, it will emerge out through the infraorbital foramen. So this is the overall course of the maxillary nerve. बुझ्यो भयो? यो बुझ्यो हो? Hello? Okay. Now just see the branches of the maxillary nerve. What are the branches of the maxillary nerve? So this is the maxillary nerve. So the maxillary nerve has got three different. This one is the intracranial because it is not coming out from the foramen rotundum. So this is the intracranial. So the intracranial part now it has the one branches that is known as the meningeal branch. But a branch so one is the meningeal branch. Now within the pterygopalatine fossa, it has the ganglionic branch. So those are the ganglionic branch. It is providing the branch to the pterygopalatine ganglia. So those are known as the ganglionic branches. The next one is in a C1 nerve going superiorly. This is known as the zygomatic nerve. For the dividing into zygomatic temporal, zygomatic facial. So this is the zygomatic nerve. Now next is we have this one. This is known as the posterior supraalveolar nerve. Can you see the three one? Anterior, middle, posterior. So all those are the supraalveolar nerve. Anterior, middle, posterior, supraalveolar nerve. Now next, the final one. This is known as the infraorbital nerve, further divided into three. One, palpebral. This one is the labial, and next one is the nasal and the labial. So those are the three branches. Let's see. Penile branch to the pterygopalatine ganglia, zygomatic nerve, supraalveolar, posterior, middle, anterior, infraorbital, palpebral, labial, nasal. Those are the branches of the maxillary nerve. And this nerve will carry the sensation from the lower eyelid, part of the side, and allows the nose, upper lip, maxillary region, and the temple region. Now just see this region. So from this region, this will carry the sensation. Okay. So allows nose, maxillary area over here, or some part of the temple also, lower eyelid, region button. So I'll try to draw the branches of the maxillary nerve. Okay? So in a maxillary nerve, what the maxillary nerve? The maxillary nerve. So this one, I'm just drawing the maxillary nerve. Maxillary nerve will come out through the trigeminal ganglia somewhere over here. Let us see. We have the trigeminal ganglia over here, and this one is the V1, which is going above the V10. I'm just tracing the V2. So this is the maxillary nerve, which will pass to the lateral wall of the cavernous sinus. Then somewhere over here, let us say somewhere over here, we have the foramen rotundum. It will enter into the pterygopalatine fossa. Suppose this one is the pterygopalatine fossa. Then it will enter into the infraorbital fissure canal. Then it will come out through the infraorbital foramen. Somewhere I'll draw over here the infraorbital foramen. Is it clear, this one? Buja view? The floor of the infraorbital fissure, then it will come out through the infraorbital foramen. And this is the foramen rotundum. Now, what are the branches? This is the intracranial course, which is present inside the skull. So we have the one branch that is known as the meningeal branch. So this is the meningeal. Now, this is the pterygopalatine fossa. Now, somewhere over here, you need about a double orbit my interval. Okay? So this is the pterygopalatine fossa. Now, the pterygopalatine fossa, it gives rise to the branch to the pterygopalatine ganglia. So let us say these are the two branches which is hanging the pterygopalatine ganglia from above. So those are the ganglionic branches. The next one is one branch is going above. This is known as the zygomatic branch. Now next we have the two from here, one, and this one is another one. Okay. So those two are posterior and middle supraalveolar nerve. So posterior and middle. Time lapse posterior and middle supraalveolar nerve. Now, what are the branches that will arise from the orbital part, infraorbital part? So from here, one branches will arise. This is known as the anterior anterior supraalveolar nerve. This is anterior supraalveolar nerve. So we have the anterior, middle, and posterior supraalveolar nerve. Now this is the infraorbital foramen. From here, this nerve will come out as the infraorbital nerve, which is further divided into three branches. It is going towards the eye, palpebral, going towards the nose, nasal, going towards the lip, labial. So these are the three terminal branches. This is the maxillary nerve. Hello? Okay. So next. The next one, so this one's the same thing. Now next one is the mandibular nerve. Now mandibular nerve is a mixed one. It has got both the sensory component and both the motor component. Now what will be the individual functional component of the mandibular nerve? As a sensory, we have the general somatic afferent. As a motor, we have the special visceral efferent. Now see this one is the mandibular nerve, which is the mixed one. It has the sensory root, it has the motor root. So this sensory root will pass downward from the trigeminal ganglia and motor root will be somewhere over here. That will get unite, and that will pass through the foramen ovale. Okay? And that will unite to form the trunk. Now this one is the trunk. Your trunk, okay? This is the trunk. The trunk will enter into the infratemporal fossa, where they will divide into the anterior division and the posterior division. বুঝিও বিও? You need drawing or this. Okay, so I'm drawing the mandibular nerve. So the mandibular nerve. So suppose this one is the motor. Suppose this one is the sensory. Become wide so and this is getting unite with each other from the trunk of the mandibular nerve. Now this is the foramen ovale. Oh, now when it exit out of the foramen ovale, it will get unite and form the trunk. So this is the trunk of the mandibular nerve. The trunk of the mandibular nerve will enter into the infratemporal fossa, where this will divide into the anterior division. This is the anterior division, and it is this one is the posterior one. Now next one. So what you have to do is you have to name the branches that is arising from the trunk, anterior division, and the posterior division. Of anterior division, trunk only branches, we just have the two branches. One is the meningeal branches, that's known as nervus spinosum. Nervus spinosum, which will enter the skull through the foramen spinosum, and it will supply the meninges, that is nervus spinosum. Next one is this is known as the nod to middle pterygoid. You nod to middle pterygoid. These are the two branches arising from the trunk. Why of you? The next one is see the anterior division. Now after you divide into the anterior division and the posterior division, now what are the branches arising from the anterior division? So from the anterior division, we have the one branches. This one is supplying. This one is supplying the temporalis muscle. So this is known as the deep temporal nerve. The next one, this one is the nerve supplying the masseteric nerve. This one is the nerve supplying the lateral pterygoid and middle pterygoid. They really supply so all four muscle of mastication: temporalis, middle pterygoid, lateral pterygoid, masseter. Now next one is we have the one sensory nerve that is known as the buccal nerve. So this is the buccal nerve. The buccal nerve is the sensory one. It is supplying the skin above the buccinator muscle. It will carry the sensation from the skin above the buccinator muscle. So this is the buccal nerve, which is the sensory. So all other four are motor. So this four are motor. This is the sensory one. So these are the branches arising from the anterior division. You presume? Now next one is from the posterior division. So from the posterior division, we have the another nerve which is going above in front of the external acoustic meatus, that is known as auriculotemporal nerve, that will arise from the posterior. Now next one we have the one nerve. This is known as the lingual nerve. And next one we have the infraalveolar nerve. This is not the lingual nerve, this is the auriculotemporal nerve, and this is the infraalveolar nerve. Your lingual, your auriculotemporal nerve. This one is known as auriculotemporal nerve, and this is known as the infraalveolar nerve. अब lingual nerve तथा बाहिरबाट यहाँबाट के attach हुन्छ, the chora tympanic nerve will attach to the lingual nerve that will carry the taste sensation, and the chora tympanic nerve is the branch of the facial, so that will attach to the lingual nerve. The lingual nerve is attached to you. This is not the branch of the posterior ramus of the mandibular nerve. Your chora tympanic nerve just will attach to the lingual nerve, and this is the infraalveolar nerve. You these are the three branches, main three branches, all branches of also. Now next one, you just read by yourself. This one is from the trunk. We have the meningeal branch, nerve to middle pterygoid, masseteric nerve, deep temporal nerve contralateral pterygoid buccal nerve. This will arise from the anterior division. Now from the posterior division, can you see from the posterior division, we have the auriculotemporal nerve, which is passing behind the axonal acoustic meatus, auriculotemporal nerve, and this one is the lingual nerve. You can see the lingual nerve, and this one is the infraalveolar nerve. Now this lingual nerve is carrying the general sensation from the anterior to third of the tongue. Now this lingual nerve is attached, or not attached, this lingual nerve relation is present posterior to the third molar teeth. Posteriorly to the third molar teeth, that is the location of the lingual nerve in a bony part of the mandible. So while extracting the third molar teeth, the care must be taken not to damage the lingual nerve, because the lingual nerve is just lying inferior to the third molar teeth, just on a posterior side. The next one is, this is the auriculotemporal nerve. Whenever we have to cancel in the tongue, in the we are having the disease in the lower jaw, then the deferred pain, the pain may be deferred to the ear and the temporal region through the auriculotemporal nerve. So this one is another condition which you have to remember. Applied anatomy. The next one is the infraalveolar nerve. Now let's see, this is the infraalveolar nerve. This is the largest terminal branch of the posterior division. Now this will enter through the mandibular foramen. You can see the mandibular foramen over here, and this will run through the mandibular canal and finally emerge out through the mental foramen over here. So before entering into the mandibular foramen, this will give rise to another branch. Another branch will arise from the infraalveolar nerve, that is known as the nerve-to-mylohyoid. भनेपछि infraalveolar nerve mandibular foramen मा छिर्नु भन्दा पहिला it will give rise to a branch that is known as the nerve-to-mylohyoid, and this nerve-to-mylohyoid will supply the anterior belly and the mylohyoid muscle. Next, the infraalveolar nerve within the mandibular canal, it will give rise to this one. It will give rise to the incisive nerve, the branches that is supplying the lower jaw, and next, finally, the mental nerve. So these are the other branches of the infraalveolar nerve. Don't get confused in the infraalveolar nerve. What you have to know is, in the infraalveolar nerve, we mainly get the two branches. One is the nerve-to-mylohyoid, next one is the mental nerve. So this is all about the branches. So GSA, SBE, you सब पढ़्नु ल आफै. Now the applied aspect, the trigeminal nerve injury को थाहा छ होला हैन. So whenever the muscle of mastication will paralyze on the affected side, then jaw will be debilitated to the opposite side. Now over here, यतातिरको muscle paralyzed छ, and jaw will deviate towards the opposite side, because the muscle of mastication of the opposite side will be in action, which will pull the jaw towards that side. There will be the loss of the facial expression. You can see the loss of the facial expression over here, the loss of the corneal reflex, and next one is the trigeminal neuralgia. The trigeminal neuralgia भनेको थाहा छ है, severe pain along the distribution of the nerve. So along the distribution of the trigeminal nerve, or along the branches of the trigeminal nerve, the pain will radiate along the branches of the trigeminal nerve, and you will be having the severe pain over the face. That is all of the trigeminal neuralgia. You detail ma पढ्नु होला है. Now this is all about the physics class. So what you have to know is, you have to know the functional component of each and every cranial nerve, and the most important, you have to know the trigeminal nerve, the branches of ophthalmic, maxillary, mandibular. What are the branches? What are the functional component? What are the areas supplied by the trigeminal nerve? All those. So the trigeminal nerve is very important. So if you have any confusion, then you can ask me. Teachers, do you have any confusion, or do you have any question? Hello? Okay. एकछिन लिभ नगर्नु ल, लिभ नगर्नु. वेट, मैले अटेन्डेन्स डाउनलोड गरेको छैन. One 128 मात्रै हो. Okay. Okay, you can leave now. Okay, thank you.